Hey, future nurses, welcome back again. And today we're going to talk about how to answer NCLEX question. I used to be so confused in the beginning, and I used to read the question incorrectly. So I would, of course, answer the question incorrectly, right? So today we're going to break down what kind of question we usually get in NCLEX and how to read those questions, how to answer it, what to look for, right? So when you go for NCLEX, keep it in your mind that they do not want you to know everything. We are human beings. There is no way you can know everything, right? But they want to know if they can trust you with human being, if they can trust you with your patients, if you're a safe nurse. So every question secretly tests you on safety. They test you on prioritization if you know how to prioritize, how to organize your day, how to delegate tasks. RN has major responsibility, so they cannot delegate each and every task to LPN, RPN, UAP. So they want to know if you know how to delegate. They want to know how you can do clinical judgment. Do you know how to do clinical judgment? What to look for? What are the worst outcome could be? And even after you try to know everything, let's say you know everything about all the disease, you know everything about all the condition, you will still get some kind of question which you don't know. So let's look into prioritization question today. So when you get prioritization question, always ask who will die first, right? So they will ask you question like, for example, you're starting your shift, you got a report about four patients, and they will give you four patient with the condition. They will trick you with vocabulary, just know your vocabulary. So they will give you four patients with four different conditions, and they will ask you which patient you will go see first, right? Those kind of questions. Or maybe they will give you one patient with four condition, and they will ask you which condition is takes more priority, right? So when you see prioritization questions, first of all, I know so many people follow ABC. ABC is important. Airway, breathing, circulation is important, but ABC does not work everywhere. I'll give you example later. But you cannot go by ABC all the time. Okay, I'll give you example right now. When you get ABC kind of question. So, for example, you have four patients, COPD patient with O2 sat 88%, post-op day one with temperature 38 degrees Celsius, patient suddenly confused, disoriented, patient with chronic back condition, rating pain 8 out of 10. So now you need to know, first of all, read all the options and try to see which patient can wait. So you can see chronic back pain, they can wait. They can wait for their opiate medication. COPD patient, you will see COPD condition is a chronic condition, right? But some people will say, oh, they have 88 ODUSAT. They are priority because they are not able to breathe. Maybe there's something wrong with their airway, so their ODUSAT is low, right? But if you know COPD is a condition where it's expected that their O2 sat is low, right? So they usually go by 88 to 92, right? So they're still okay. Even with 88 sat, they are still okay. So post-op day one with temperature 38 degrees Celsius. Now you will say, oh, they are fresh post-op, 24 hours. Maybe they have infection. That's why they have fever, right? So yeah, could be. They have, so you will see infection after 72 hours, but maybe it's exceptional case, right? So okay, let's see it. Maybe they have infection, but they can wait for their medication, right? For the third patient is patient suddenly confused and disoriented. So you can see patient suddenly. So look for these kind of words. Suddenly means their condition changed recently, unexpected changes. So acute neuro changes. Even though acute neuro changes is not part of ABC, but you can see it's unexpected, sudden change. So we want to know what's going on with that patient. We want to worry about that patient's safety, right? So we will prioritize this patient with sudden confusion and disorientation. So now you know, like ABC does not work everywhere. I know ABC is important, but it does not work everywhere. So that was my example to prove ABC does not work everywhere. Okay, so the other thing you need to look for is safety, risk of harm, like suicide, confused, like our previous example, they're bleeding, they having any resp issues, right? So we want to look for safety issues, like they're choking, those kind of issues. So we always prioritize patient with safety issues. Next would be acute versus chronic. So acute issues like sudden, new, like same example, like there was one word which is suddenly. Suddenly they having confused or disoriented symptoms. So new, sudden, changing, unstable, those kind of words you need to look for, which is acute changes. Chronic is like long-term expected, like in COPD patient, you expect their O2 sat would be low, right? It's a baseline. On the next would be unstable versus stable. So new onset, changing vital signs, hemorrhage, high fever, chest pain, neuro changes. We have to prioritize those patients over stable. Like with chronic expected condition, there is no big change. Like same COPD patient. I'm sorry, I'm taking same example, but that example actually makes sense. So COPD is chronic condition 88, which is expected, right? Um, so our acute patient with unexpected symptom will take priority. Fresh post-op versus old post-op. So fresh post-op is actually less than 12 hours. They have higher risk because we have to frequently check those patients. So they have higher risk. If you see sudden change in those kind of patient, would take priority over any other patient with let's say 24-hour post-op, right? So let's take one more example here. 45-year-old with DKA, blood glucose 520, potassium 5.8, respiratory rate 28, alert and oriented. Okay, good. DKA, chronic condition. We do not worry about age. Age doesn't matter. The gender doesn't matter. Like female do not take priority over male, right? That gender doesn't matter. Age doesn't matter until unless it's ped situation. And um, we want to look for diagnosis. We want to pay more attention to modified phrase. So if I want to explain what is modified phrase, so if we go back to the same example, which is 45-year male, DKA, blood glucose 520, potassium 5.8, respiratory rate 28, alert and oriented. Modified phrase is the last phrase, which is alert and oriented, or if it says disoriented or confused, right? So that's modified phrase, and we want to pay more attention to those modifying phrase. Um, Patient B, 72-year old with pneumonia, O2 sat 89% on room air, productive cough, febrile 38.5. Okay, pneumonia. Pneumonia is infection in lungs. Their O2 sat would be low because they don't have much space in their lungs because they should have fluid due to pneumonia. And they're productive, and it's on room air. 89 is on room air, right? They have productive cough, they're febrile because it's infection. The fever is expected, right? So this is expected situation. So option A, expected. Option B, expected. Option C, 60-year-old with chest pain radiating to left arm, diaphoretic and nauseated. So 60-year-old. As I mentioned, age doesn't matter, but they having chest pain radiating to the left side. They having sweating. They are nauseous. So you can see the symptoms. Usually, if people have pain on the left side, it's angina or MI, possible MI, right? So, okay, we want to keep this patient on our list. Patient D, 30-year-old with sickle cell crisis, pain 10 on 10, warm and jaundiced, stable vitals. Stable vitals, modified frame. They have sickle cell crisis. They will have pain for sure, and they are warm and jaundiced. So this patient is stable. I know they have jaundice. They're warm. They're having pain, but they're stable. They can wait. But you can see patient C, they have pain radiating to the left side. Sometimes they say left side, left shoulder, jaw pain, right? So these kind of symptoms are in angina. You will see in angina or MI. So C would be our priority patient because this patient having MI or angina, but we need to look into that patient and prioritize that patient over every other patient because every other patient are stable. They have expected symptom. They are not dying, right? But if we don't go and check patient C, that patient will for sure die, right? So that's how you will look into the priority question. Maybe in future I'll do more prioritization or delegation kind of questions just to give you more clarity. And let me know if you have any more question. I will go over more other types of question in upcoming videos. So stay tuned and follow for more.